Hi, I'm Dr. George Barrett. I'm the Chief of Gastroenterology here at Beth Deaconess Hospital, Milton. And I'm here to talk to you today about some common ailments that I treat in my office here. And one of the more common disease processes that I treat is celiac disease. So celiac is actually an allergy to a protein in wheat, which is gluten. The classic presentation was more gastrointestinal symptoms of bloating, cramps, diarrhea, loose bowels, and malabsorption. So the classical disease that I mentioned, we're seeing less of, and we're seeing more of the atypical symptoms as a presentation, which is more osteoporosis or migraines or depression, malnutrition, vitamin deficiencies, which is very fascinating. One of the most significant is vitamin deficiencies. So you can have iron deficiency, vitamin D deficiency, calcium deficiency causing premature osteoporosis, and it can go on to develop, untreated disease can go on to develop lymphoma of the small intestine. It's rare, but still something that could happen. 15 years ago or so, a blood test was found that could easily screen people, and all you have to do now is think of celiac and you order the blood test, and we're seeing many more people with it. And the incidence now we feel is about 1 in about 150 in the United States. To make the diagnosis or clinch the diagnosis, an endoscopy is needed to take a piece of the small intestine and look at it under the microscope and look for villus atrophy. The villi are these little finger-like projections in the intestines, and they're destroyed when you have active celiac disease, and that's what clinches the diagnosis. Taking gluten out of your diet will cause the disease to be completely reversed. But you have to be 100% gluten-free. But taking gluten completely out of your diet is a daunting task, and it takes people about a year to become gluten-free. You can become 80% gluten-free fairly quickly, but it takes a year to learn all the small things that might contain gluten. And I always refer them to a nutritionist who's an expert in celiac disease, and they have to work with them over that period of time to become completely gluten-free. Certainly anybody who's iron deficient or shows evidence of premature osteoporosis or has another autoimmune disorder, they say that all patients with diabetes should be checked for celiac disease. Or anybody who presents with vitamin D deficiency should consider it. Most of the cases occur as a child, but there is a condition called latent celiac where you can have been on a gluten-containing diet most of your life and suddenly develop it. I've had several patients who I've checked 3 and 4 times that were negative, and suddenly they became positive. I was so suspicious of it. And there are other entities where they've had celiac as a child, then outgrew it, had part of their life, 20, 30 years with gluten, and suddenly it reappears. So yes, it is a sneaky disease like that, and you have to constantly think about it.